Now, USA Medical Center officials are taking a look at how they handled yesterday's Ebola scare.
Health officials say their staff executed the plans in place, but how equipped is the hospital to treat the actual virus?
Local 15's Modupe Idowu was also at this morning's news conference. Modupe, what did you learn?
Well, Greg, we've talked a lot about healthcare officials, how they're taking measures and taking steps to protect each other from contracting Ebola if it were to come to the port city. What we haven't heard is about the hospital's ability to treat Ebola, and we've learned that they do not have access to the experimental drugs that have successfully treated the virus. The outside of USA Medical Center looked quite chaotic last night, but behind closed doors, Administrator Beth Anderson says the hospital executed plans in place when dealing with the suspected case of Ebola.
I'm very pleased.
When the woman arrived, she was placed in a special room. All patients were cleared from the ER.
And I was turned away, told that they wasn't taking patients.
Patients who later tried to go inside were directed to other ERs. The one thing Anderson says the hospital needs to reevaluate.
We will definitely take a look at that issue as to where those patients probably need to enter our hospital and go so that our operations can continue on all fronts.
Turns out the woman was at no risk for Ebola. If the virus makes its way to the port city, USA Medical Center officials say it's ready with isolation units, buddy systems for its healthcare workers who must don protective gear, and has waste procedures set. But what about the hospital's ability to treat the actual virus?
We don't have a specific antiviral medications available.
Or access to experimental drugs used to successfully treat American missionaries.
What we do have is the knowledge that the patients need more supportive care.
That includes IV fluids and blood transfusions, and those responsible for tracking who has come in contact with an infected person lies on the shoulders of the health department.
And we actually go door to door and follow up currently on certain reportable diseases and make sure that people who have been exposed are properly tested and notified.
Now, officials here say managing Ebola is a community effort. They say not only hospitals in the area, but urgent cares and doctors' offices and schools need to be aware of what to look out for in order to protect themselves and others. Now, reporting live at USA Medical, I'm Modupe Idowu, Local 15 News.